This is an ABP Live Podcast.
Now, I have been infected with COVID 2 times in a row. Once during the Delta variant and once during the Omicron variant. Now, during the Delta variant, first my mother got infected and then it was my number. And my luck was so bad, my final semester exams were to be held at that time. It was such a terrible nightmare. Although I had online exams, but I didn't even have the strength to sit on a chair. I remember, after writing every answer, I used to lay down on bed for 15-20 minutes. It was too much to handle. But fortunately, my mother and I soon recovered from COVID, the Delta variant, the most deadly variant of COVID. And immediately after that, I took my mother, my father and my sister to get the vaccine. I knew it was very important to get the COVID jabs at that time. Now, I did take the 2 jabs of Covishield. But when it came to booster dose, I skipped. I have reasons for it, okay? During that time, I got my first job. I had to move to Delhi again. So in the middle of all this, I forgot to take the booster dose. And now, COVID is back again. Experts are saying that we have to get the booster dose to stay safe from the BF7 variant. But fortunately, Bharat Biotech has now rolled out a nasal vaccine, which is going to be used as a booster shot. Now the people are curious about this nasal vaccine. What exactly is this nasal vaccine? Will it keep us safe against the new BF7 variant? How to get this nasal vaccine? Don't worry, I'll decode all of this today because even I have to get it, na? I have to get my booster shot. So welcome to Clear Cut, only on ABP Live Podcast. This is your newsman Rudrashish, and today let's talk about the new nasal vaccine and how effective will this be. So let's get started. So, amid a sharp uptick in COVID-19 cases around the world, especially in our neighboring country China, the government on Friday approved Bharat Biotech's intranasal vaccine as a booster dose for those aged 18 years and above. Now this nasal vaccine is called iNCOVACC and it has received approval of the drugs regulator in November for restricted use in an emergency situation as a heterologous booster dose. I think I spelled it right. If I don't, please correct me. Now, you might be wondering, what is this heterologous booster dose? So, this heterologous booster dose means a person can be administered a different vaccine as a third booster shot from the one that he or she received as the primary dose. Now, countries around the world are now witnessing a huge spike in COVID. Countries like the United States, Japan are witnessing lakhs and lakhs of cases daily. Some media reports are even suggesting that China is witnessing millions and millions of COVID cases on a daily basis. Now that's really alarming and dangerous. So now the question is, what should we do? Should we go and take the nasal vaccine, the booster shot? Of course you should. The government of India has appealed to the eligible citizens to get their booster or precautionary third dose. Now, most of the people of India have taken both the COVID shots, both the COVID jabs. But when it comes to the booster shot, only 27% of the Indian population have taken the booster shot. If we talk about numbers, then a total of 22.35 crore booster shots have been administered in India till today. And this number is really low. Now to help you people get the booster shot, here are some things that you should keep in mind. So the 2-drop needle-free nasal vaccine is available on the Covishield platform from Friday evening. And eligible people can book their shot from the mobile application or the website. The nasal vaccine will be available only at private hospitals as of now. iNCOVACC vaccine will be stable at 2 to 8 degrees Celsius for easy storage and distribution. It can only be taken as a precaution or third dose by adults who have been vaccinated with 2 doses of either Covishield or Covaxin. Now, if you're wondering why is this vaccine given in the nose? Now the target is to deliver the dose into the respiratory pathways. The vaccine is injected through a specific nasal spray. Now nasal vaccines are also very easy to administer and builds up immune barriers in the respiratory tract through which respiratory viruses enter the body. It must be noted that the respiratory tract epithelium is the key entry point for the novel coronavirus. Now you people might be wondering, why should you get this vaccine? You've already been administered the 2 Covishield or Covaxin jabs. You're safe. And even if you were to get this booster shot, how long will the immunity from this iNCOVACC vaccine last? What's the efficacy rate of this iNCOVACC vaccine? Now, to answer all of your questions, I have Dr. Aviral Mathur joining us on the show today. Dr. Mathur is a practicing doctor at Maulana Azad Medical College in Delhi. So, welcome to Clearcut, Dr. Mathur. It's a pleasure to have you on the show.
Thank you and good evening.
So, sir, the Bharat Biotech has come out with this new nasal vaccine. And लोग इसे काफी पसंद करें क्योंकि this is not a syringe type of vaccine. ये बहुत ही easily administered vaccine है. और लोग इसे they are in doubt कि ये कितना effective होगा. What is the efficacy of this vaccine? So can you tell us something about the efficacy rate of this vaccine and what's in this vaccine that people are liking it so much?
Okay. Such types of vaccines, this is not the first time that such a type of vaccine has been discovered. Rather, in September of 2022 itself, China approved a vaccine, I think, which was called Covishield, which was an adenovirus type of vaccine, which was an oral vaccine. Okay, it is still currently being administered in Shanghai. The results with that vaccine have been very promising. So the nasal vaccine was developed because the mechanism of action of the SARS virus, the COVID virus, is mainly through the nasal and oral mucosal route. So what they are trying to do is they are trying to create a barrier there itself, so that both transmission and infection to further people are prevented equally.
Okay.
So the efficacy regarding how efficacious this is of course it will be released in the long-term trials. The trials that they have conducted until now, mostly phase 1, phase 2 and phase 3 have been very promising. In fact, in the phase 1 trials in which they conducted, after administration of this vaccine to mice and rhesus monkey, they determined that the level of protection in both of them with the nasal vaccine was superior to that of the intramuscular one, which was administered until now.
Okay. Now, this vaccine, this nasal vaccine, this is also called iNCOVACC, right?
Okay, yeah.
Now, this people are saying that doctors are suggesting that people should take this vaccine as a booster dose. Everyone above 18 years old should take this as a booster dose. But हम लोगों ने जब वो कोविड जैब्स लिए थे तब एक गैप था 3-6 महीने के बीच में कोविड सेकेंड जैब लगता था. अब इवन इंक्लूडिंग मी, मैंने ये जो कोविशील्ड वैक्सीन लिया था, इट वाज बैक इन जनवरी. तो अभी ऑलमोस्ट 1 साल बीत गया है. तो इस गैप की वजह से इस बूस्टर डोज के कोई इफेक्ट होगा?
Yeah, so basically this vaccine currently is being released only for those set of people who have taken 2 of their doses from the recommended 3 doses. Doesn't matter which vaccine they have taken. This will cover both Covaxin and Covishield, and also to some extent the Pfizer vaccine, but mostly because Indian population has an exposure to Covishield and Covaxin. Anybody who has taken 2 doses can go and get this as the 3rd dose, irrespective of which vaccine they took. Moreover, having a booster, it is being released as a booster dose right now because immunity works in a manner in which there is a graphical. If I could draw a graphical representation, the immunity tends to die out with a period of time.
Okay.
So naturally, if somebody, a subset of population which got vaccinated, say 1 year back, which, they took both the doses and the last dose was almost a year back, which was mostly with the healthcare workers, myself included, they will now have their IgM antibody ratios going down in the blood. So IgM is an acute phase antibody and IgG is a long-term antibody. So what this vaccine will do is further augment the long-term response and also provide with an acute antibody which will help, if there is an impending wave coming, then it will help fight the virus. So this will only supplement the already existing immunity in the individuals. Doesn't matter what time period, how much time period has elapsed between the last dose and their subsequent 3rd dose. Doesn't matter. It will only supplement, and moreover, because it is also targeting the mucosal antibody. So there are many types of antibody responses our body has. The one of them, which is the most refined, is the mucosal antibody response, which is especially present in all the orifices of the body. So nasal orifices, oral mucosa, they have mucosal IgA antibodies, which are the special target for this vaccine, and therefore they will augment antibody response from this area, and it will prevent any exposure to a upper respiratory tract infection.
Okay.
So it will help both the subsets of population.
Okay. And lastly, I want to ask you that since this is a very easy to use vaccine, can this vaccine be self-administered, and how long do you think the immunity from the vaccine can last in a person?
Okay, so currently what Bharat Biotech has recommended is that in their special sheet which they released with the vaccine, they said that it doesn't require any special healthcare professional to administer the vaccine naturally. So it is easy. You have to just administer 4 drops in a manner which you have to do a head tilt in one of the nostrils after clearing them out. 4 drops into that nostril, and then 4 in the other. 8 drops if total you are taking it, and you can do it by your on your own also. But currently they are using the the databases and the manpower of the private hospitals and all these setups, so that it is let out in a very streamlined manner. Otherwise, it would be a ruckus. Still, people use, say, for example, many people use Otrivin nasal drops to clear the symptoms of cough and cold. They use saline nasal drops. It's very easy. So you can do it. It is non-invasive, non-painful. All you need to do is breathe in 4 drops and let it accumulate. But I don't think that the government has still rolled out that it can be self-administered. Currently, it is only through the Covin app, and you have to figure out the nearest center, and you have to go and somebody will administer it for you. That somebody doesn't need to be a specialized healthcare provider. That is okay.
Okay. And how long do you think this immunity from this vaccine will last?
Again, in their studies that they conducted, they found that it is providing protection both for IgM and IgG. IgG is something which will last for years to come. Depends on the individual again. Every individual reacts differently, but long-term studies will only tell that after a substantial period of time, the effect of the vaccine starts to wane away. Say, for example, to give you a perspective, if you must have heard that it is recommended that you get the booster dose of a tetanus after every 5 years.
Yes.
So that was only possible after long-term studies when they realized that, 5 years is a window which is good enough for protection. After that, if you get exposed, it is better that you get another dose. So maybe, because these studies that were conducted were only mainly through the later part of 2021 and the early part of 2022. It is less than a year. So very difficult to comment upon that. But we are very sure that this is going to provide at least good 1 year from the time of administration.
Okay. Well, sir, thank you so much for joining us on the show today. It was a pleasure speaking to you.
Sure, same here. Thank you.
Thank you so much, sir. So that's all the news and scoops I have for you today. This episode was produced by Lalit. This is your newsman Rudrashish Kanjilal signing off. Have a wonderful day ahead and keep listening to ABP Live Podcasts.
This is an ABP Live Podcast.